Hello, welcome to Pressure Point. I'm your host, Valerie Dudoward. My guest this program is Angie Todd-Denis. Welcome, Angie. I have been looking forward to speaking with you during this program. I think I thought about asking you to do this. If I had asked you to send a CV, 10 minutes of the program would have gone by, so we'll try to cover it over the next little while. But first, I wanted to ask, what's with the title of the program that I can't pronounce?
Okay. Well, I'll just show this to you. I did a report a couple of summers ago for BC Women's Health Centre, and Quam Sleni is a Musqueam word for strong women. I had to look at women's health issues in Lower Mainland, and I asked Edna Stogan from the Musqueam Reserve to give me a title, because after all, this is Stolo territory. And so that's the name she gave me, and I'm quite happy with it, because it really epitomizes the strength of many of our Aboriginal women in this province.
I know that the topic in general of Aboriginal women has been one that you have been really a forefront leader of in many different issues, as far as employment, leadership, and now health in terms of Aboriginal women. Is there something specific in your background that just really led you to focus on that area?
I think in my early career, I realized that there was a lot of isolation, there was a lot of neglect. I'd like to just tell people that I probably was one of the early Aboriginal women that went to university. And I can remember my friend Shirley Morvan, who is Niska, at that time saying, "Gee, Angie, you know, we were at university when there were more totem poles than Indians." And so I'm happy to see that that's changed. At any rate, being an educated woman isolated me in a lot of ways.
From your community or from other women?
I was educated quite by fluke. If I had remained a status Indian, you know, I think I probably wouldn't have gotten the education, or it would have come later in life. But at the age of 9 years of age, I was removed from residential school because my mom married a non-native. And it wasn't until I was 21 years of age that someone said, "Angie, they've misinterpreted the act, because according to the Indian Act of 1956, before that, if you were born an Indian, you stayed an Indian." So in those days, I went off to Ottawa, and I went to the membership office and said, "Look, I still think I have my status, and I want you to look for it." They thought I was joking, but I was there the second day faithful at 8:30. 4:30 I was still there, and at the end of the third day, somebody comes and says, "Yes, Angie, we found it. We misinterpreted the act, so we're real sorry that from the time you're 9 years old to the time you're 21 years of age, you are a non-status Indian." Had I remained a non-status or a status Indian, I may have gone the road of many of our women, been placed on the general program rather than the academic program, been encouraged to be a practical nurse rather than a school teacher. Our men at that time were encouraged to be heavy-duty mechanics. So there wasn't much choice. I mean, Indian Affairs didn't have much in the way of, they offered no choices, what I can see, you know. So because I then was educated in a high school up north, which was a convent, there was only one choice: academics. So I graduated grade 13 and went into university and became a teacher, and was a teacher and an educator for a number of years. But along the way, I saw that our Native women were, there was a lot of issues that they couldn't handle, you know, racist attitudes, unemployment, poverty, their children being removed, and there was no advocacy at all for many of our women.
The leadership of the nations, of the bands, of the tribal councils, of the provincial associations?
Well, if I recall, they were just beginning to be formed. Like we used to think when I was growing up, the Indian agent had a lot of power. And it wasn't until a few years ago that one of my foster parents said they were just clerks. They were just government clerks. And they were given a lot of power. And so I think that it was in the 50s when I can remember George Manuel going to all of the reserves and saying that we have to unite and we have to take back our power and we must meet. And two people were sent off from our reserve down to Vancouver to this important meeting, and several years later the Union of BC Indian Chiefs were formed and women's groups were beginning to be formed. And so I think that it's hard to say just where leadership started to generate. However, I'm not happy with the kind of leadership that we have. I think that they followed the government model. You see it in the kind of government that we have on our reserves. We see it in the quality of leadership that we have on many of our reserves, which is very, very poor. We see it in the way that the traditional role of women has been eroded and not respected. I mean, we have our leaders that say, oh yes, we respect our women, oh yes, we do these kind of traditional things, but they don't. 90% of our women have suffered violence sometime in their lives. That's not respect.
And that's not traditional.
And it's not traditional. And why would, like one of the stats that I have here is that the number of Aboriginal women that commit suicide is 6 times the provincial rate. They don't kill themselves for no reason, you know, so there's got to be a lot of issues. And I think, you know, now that women have been neglected and are being neglected, and I have a real issue with this NDP government, with all of their rhetoric about equality and women's equality. We don't have a single Indian women's group in the province that is being core funded by the government. We have 43 other women's groups that are being funded, but none of our women's groups have that kind of core funding. So I have real issues.
A heavy commitment, core funding for those people who aren't familiar with that terminology means a significant commitment of policy.
Well,
and
it's
practice.
not significant. It might be $30,000 or $40,000, but that's enough to keep an office open. And with the office that we have here,
so there isn't even that.
No.
You're saying for Aboriginal women.
We made a little bit of noise recently, and Women's Equality came up with some money, but it is one-shot thing. Okay. No, I really believe that this government should put their money where their mouth is, and as far as Aboriginal women's issues are concerned, they need to make a commitment. And I just spoke to a group yesterday in which we told the leadership, you know, Eddie John was there.
Who's a leader from the Carriers
provincial,
Academy.
Yeah, and who's one of our leaders from my area, that the summit has to make, you know, some significant contributions of support of women's groups and to recognize we're not part of the treaty process. I really support the youth in the stand that they took 3 weeks ago, in which they sat in the treaty offices and said, you're discussing our future and we're not a part of it. Well, I'm saying the same thing for Aboriginal women. You're discussing our future and we're not a part of it, you know? So a friend and I were looking at it a couple of weekends ago and saying, well, there's the youth, there's women, there's the elders. And frequently, you know, we're part of the voiceless majority in Aboriginal country. And frequently we're being governed by a bunch of high school dropouts. And I deeply resent that. And I don't think it's a situation that needs to be.
So what is one doable, workable, reasonable, affordable step that could be taken that would bring maybe not a smile to your face, but a glimmer, I guess, that they're on the right step toward doing what you want?
Anybody? Well, money always helps. Money always helps. If we can keep our women's office going, if we can have one staff member that can work, we've got tons of women that would be willing to, you know, volunteer their time. So right now we're working on a very, very small budget, but we need an advocate for Aboriginal women's issues. We need a health planner. We've just recently changed focus within our mandate to look at advocacy, research, and service to Aboriginal women. And so we've got some long-range plans, but you can't have a full-time job and do this other thing at the same time, you know, so yes, money.
And this is the Association
Of First Nations Women. And we're situated in Vancouver. And we've probably been going for about 20 years, and we probably have the largest paid up membership of all of the women's groups in British Columbia, Aboriginal women's groups.
How many Aboriginal women's groups are there currently in BC?
Well, there's a few women's groups that say that they are women's groups. They might be made up of 2 or 3 women. There's not very many that belong to the Register of Societies, but there's one in Prince Rupert, there's one here, there's an Indian Homemakers, there's one being started in Terrace, Kitimat, Gitsan, Upper Island, and Women of Native Ancestry in Nanaimo. So I don't know how many but all of those are trying to become registered. So there's a few groups.
Why do you think it seems, and I'm only interpreting what you're saying, it seems necessary from your point of view to be lobbying from without the established leadership of the Aboriginal community for women's health issues, for example, when women are more than 50% of the community of Aboriginal people?
It's the sexist nature of this society, and unfortunately our Aboriginal men have fallen into that kind of trap. Simple.
Can you, maybe you don't have to name names, but or not even initials, but an example of what you mean. You know, when I hear a statement like that, I think...
Look, okay, I'll give you an example. This government has called upon any number of male leadership in this province in the last 8 years for consultation on different issues, primarily the land claims.
Which encompasses everything.
Yes.
Everything.
Those fellows get paid $800 to $1,000 a day. Consultation fees by the government. I haven't heard of great many Native women getting consulted over any issue or asking to be a consultant on any major issue. So that's a very good example. So I'd like some of that, those $1,000 fees per day. I'd give my time.
And what way, if you think there is a way, to begin to work from within the community, the Aboriginal community, exists? Or is there a way right now?
Well, I think that we need to, I know this is such a overused word, but to empower our women. And this is the way I look at health. I look at health as community development, that we can't make a person healthy or a community healthy. They have to decide that they want to be healthy and start with their own health. And so in order to, when I work with communities in identifying women's health issues, we look at the issue, and again, I find the way that Native people really look at their health, you know, when I speak to women, it's from a very holistic way. And for many of them, if you ask what is your health issue, they'll not think about their health. They'll think about their family's health, they'll think about their community health, and they tend to look at it very holistically, you know, from a spiritual as well as a physical and from a mentally, you know, an emotional perspective. So I think that we need to, and we try to do this in our association, is empower women by helping them to find information on finding jobs, by offering workshops on different issues, by giving them information on health, by directing them to the right service. All of these kinds of things that, you know, women first coming into the city or even an established urban dweller will find useful. So I think that when women start feeling good about themselves, they'll be able to do a whole lot of things. So that empowerment and ways to empower even one person per year, I think it's so worthwhile.
Why don't, very general statement, but why don't, in general, Aboriginal women feel good about themselves?
Well, again, we go back to, first of all, we live in a racist society. Let's face it. I don't care how many sociologists and how many ministers say we don't, we do, okay? For many colored people in our country, this is a racist society. You walk into a restaurant, there's a different attitude. I have to tell you a story of an incident that happened years ago. People look at me, and as soon as they found out I was a teacher, the attitude changed. Well, we had this conference, and we all had to introduce ourselves. And I was kind of like a little bit of a smart ass. I was sitting beside I was sitting beside two nuns. So they said, I'm this and I'm that, and the circle went around, and it came to me, and I said, well, my name is Angie, and I'm a prostitute. Those nuns sort of, took about 3 seats away from me. And then I later explained to them that makes a real difference, all of these labels. And when I first encountered it as a young school teacher, I was 20 years old, I had a parent that wanted to take her child out of my classroom because I was an Indian. And you know what the principal told that parent? He said, if you want that child removed from Miss Todd's class, you're going to have to leave the district. So I think racism is a big factor. Poverty is a factor.
And I think, sometimes desensitization happens with all of us in society. And I think perhaps viewers who might be watching might think the statistics that they had heard for decades about the suicide of Aboriginal youth, about the poverty, the grinding poverty, and now the grinding urban poverty of Aboriginal and Métis people, that's somehow historical, and that a lot of the popular or pop media really focuses on multi-$100 billion settlements and the treaty process. And I think that somehow we as Aboriginal people are being put into a land that is very fluid right now, where it's very easy, I think, for the public to say, well, thank goodness that problem's, resolved now. And yet here we are. And you're talking about the suicide of Aboriginal women. We are looking still at a situation which has been very much in the news where, and I'm not a statistician, I can hardly say it, I don't know what the percentage is, but very, very high percentage of children in care of the provincial government of BC are Aboriginal. Overwhelming percentage. Look in the prisons, that hasn't changed. So we're still locked in whatever it is that's resulted from the policies and the legislation that really impacted our ancestors so much. So what is it that keeps you really basically, I guess, butting heads? Where do you get the strength from?
I think there's, when I see there's a sense of injustice and there's something that I can do about it, at least speak about it, I will do so. I know that there's lots of people in the community that don't like the kind of aggressive way that I pursue things, but to me, if I tell the truth and I've got my facts right and it's correct and it's identifying a real problem and there doesn't need to be a problem, I will pursue it. Because I think that's the only way you're going to get things done. And as long as that our women don't have the adequate funds, and our youth aren't getting educated and can't find jobs. And we see, there's favoritism by government to fund certain groups and certain people. Well, I'll just continue speaking to issues. And where I find my strength from is, my family, my friends. I'm going to be new grandma for the first time in October.
Congratulations.
And I think my experience in Hawaii was probably the singular most important thing that happened in my adult life. I went back to school when I was 50. I went to Hawaii.
To the University of Hawaii.
University of Hawaii. I lived there for 2 years. I was part of the majority. I was one of the colored folks that was just a nice shade of brown. For the first time I experienced being part of the majority. And it was the most astounding thing to me because all of a sudden I felt that I fitted into my skin for the first time in my life. And my young son was with me, and he was taking grade 12, and he had spent all of his years here on the west side of Vancouver and hassled all the time and beaten up. And he's counted in 1 3-month period, Vancouver City Police stopped him and asked him and hassled him at bus stops 22 times.
In what period of time?
3 months. So anyway, that experience for him in Hawaii was good too. So to be part of a majority was just an excellent experience.
And so now, from that, you have a new degree.
Master of Public Health.
Congratulations.
One of 3 women in the province, by the way, that has it. One of 3 Native women.
So where do you want to go from here?
Where do I want to go from here? Well, I'd really like to continue being active in women's health, particularly Aboriginal women's health. Our association wants to see that a women's clinic is established because our cervical and breast cancer mortality rate is quite high compared to the provincial norm.
Why is that? Does that know?
Late diagnosis is one.
Education, I guess,
and
awareness.
Many women are fearful of just the very nature of a pap smear. And because if you've been to residential school or if you've been abused, you're very careful about who touches you. So there's also just the very fear of having cancer, and you'd rather not know about it. You'd rather not even discuss it. So, but certainly late diagnosis is one of the big factors, and I find that with Indigenous women from around the world, that's one of the biggest factors.
Late diagnosis.
Yep. So a lot of it is preventable. Just women need to get screened. So I went from education into health, and this is where I want to stay.
What do you think is, or do you think there is a difference in the health needs of Aboriginal women in urban areas? Like more than 50% of us live in urban areas than on reserve. Do you think there are differing health needs for Aboriginal women from, say, a rural area to the urban?
I certainly think that there are fewer services and resources in the rural areas, particularly up north. If you compare all of the regions and compare the mortality rates, between Aboriginal women and non-Aboriginal women in any, disease condition, cardiovascular, cancer, all of those, we're always either got a higher rate or a lower rate, whichever it is. I mean, certainly the mortality rates are sort of consistent. For Aboriginal women in the urban areas, it's never been determined, for instance, what the screening rate is. There's never been any research. So for a lot of these things, there's no comparisons because there's been an aversion, first of all, to research. So we're trying to encourage a real participatory approach to research so that we can start examining our own health issues. I think that we certainly have more services in the urban area, but to what degree are they utilized, we don't know. But services in the northern areas are just, it's very definitely, you can see the rates there. Big increase in the northern areas compared to the southern areas in some of the mortality rates. So.
just, for example, Jill or Joe Average had been listening for the last 20-odd minutes and really wanted to do one thing to be of assistance. Is there anything that you can think of that people could do? Not necessarily Aboriginal people, but any people, to be of assistance?
Oh, they can join our association for $5 and become an associate member.
And that's
they
the
can
Association
give
of
First Nations women. They can give larger donations because we're wanting to start a health information center for women, Aboriginal women. That's going to be our first step towards this eventual clinic. So, and we always have been looking for donations for a lot of our youth that come, that don't have the blankets, the kitchenware, if they want to set up, you know. So our office has a youth component to it too, where the Native Youth Movement have a desk and the use of our phones and our computers, and they frequently come, you know, for meetings and things like that. So we do assist the youth, part of our voiceless majority.
Yes.
Yes.
Is there a telephone number that people could call?
Yes, yes, they can call us at 873-1833. And this is in Vancouver, area code 604.
Angie Todd-Denis, thank you very much. This has been Pressure Point. I'm Valerie Dudoward, and this has been Pressure Point.